This poster presentation is called Are Opioids Enough? Reviewing the effects of complementary therapies on postoperative pain management and patient recovery. The research was conducted by Jasmin Waples, Sarah Diehl, and Natasha Chamberlain, 3 junior level nursing students. The work in this presentation is not original and is an evidence-based practice brief that includes published research conducted by professionals. For our PICO question, we wanted to answer how the use of complementary therapies such as acupuncture, music therapy, and massage in conjunction with opioid analgesia affects recovery outcomes of adult patients who undergo surgery compared to the use of opioids alone.
To start off, let's define some key terms. Opioids are pain medications that are highly regulated and often used as a primary intervention for patients experiencing postoperative pain. However, as many of you are aware, the United States is in the midst of an opioid crisis right now. Not only that, but these are medications that can cause significant side effects such as vomiting, constipation, sedation, respiratory depression, and dependence, all of which can affect recovery and overall patient outcomes. Not only that, but adverse events related to opioid administration accounts for over $70 billion in expenses. As future nurses, pain management is one of our primary priorities for our patients. In addition to giving our patients medications like opioids for pain, we often seek out other means of non-pharmacological interventions. In other words, we do all that we can to reduce pain by using other methods that are not medications. Complementary therapies, which are considered to be alternative therapies, are interventions that nurses use to help accomplish the goal of pain relief. The combination of opioids and complementary therapies is termed as a multimodal pain approach and is a way to pain management that is of increasing interest due to the opioid epidemic. Examples of complementary therapies that will be covered in this presentation are acupuncture, massage therapy, music therapy, and reflexology. However, there are many more complementary therapies available for application. 6 research articles were appraised to answer our PICO question and determine if pain relief is indeed greater in patients who receive complementary therapies in addition to opioids than in patients who received only opioids. The first 2 articles on the table aim to assess the effects of acupuncture on pain relief in patients who underwent surgery. The first study, titled Acupuncture for Postoperative Pain in Day Surgery Patients Undergoing Arthroscopic Shoulder Surgery, was conducted by Ward and Nielsen, 2 nurses, in 2013. It is a level 3 quasi-experimental study and involved 22 participants. This study included a control and experimental group, and those who were placed in the experimental group received a 30-minute acupuncture treatment in addition to standard postoperative pain relief, in which the study included opioid administration. Pain scores were gathered through the use of 11-point numeric rating scale as a set intervals post-operatively, the greatest time interval being postoperative day 1. The results from the study show that pain scores on POD1 decreased 1 point in the experimental group, while those in the control group had an increase in pain scores by 2 points. The current study shows that acupuncture may be effective in the immediate postoperative period. The second study, involving acupuncture, titled Acupuncture Provides Short-Term Pain Relief for Patients in Total Joint Replacement Program, written by Krepson and the team of researchers in 2015, is a level 3 retrospective observational study. It involved charts from 2,500 patients who underwent total hip and total knee replacements. The relationship between pain scores using the 11-point numeric rating scale and acupuncture was reviewed. This study did not involve a control group. All patients who underwent surgery received the standard of care, which involved opioid medication administration and an option to offer acupuncture after physical therapy sessions. Some patients were even able to receive multiple treatments depending on the day of the week they had surgery. Overall, participants who opted for acupuncture had a decrease in pain scores. Patients with total hip replacements had a greater reduction in pain scores with the first application of acupuncture on postoperative day 1 than those who had a total knee replacement. However, the patients who received acupuncture on postoperative day 2 had an even greater reduction in pain scores than those who had only received 1 therapy. This implies that repeated treatments may provide the greatest relief of pain. This study shows promise for long-term effects if it were to be studied. Secondly, Two articles utilized for music therapy assessed how musical interventions provided during the post-operative period affected pain scores in orthopedic patients. The article, "The Effect of Listening to Music on Post-Operative Pain in Adult Orthopedic Patients," conducted by Schneider in 2016, was a comparative, descriptive, quasi-experimental study design. It is a level 3 study design and involved 42 participants. Participants were allotted individual CD players with their own headphones. Each CD was loaded with 10 pre-recorded musical songs consisting of piano music consistent with recommended tempos. This beat should be between 60 and 80 beats per minute, which follows normal physiologic rhythms. Participants were given an instruction sheet as well as verbal instructions on the study's aim, which included log sheets, pens, and a satisfaction survey. Participants' logs were recorded and analyzed. The study yielded a reduction in pain scores associated with postoperative orthopedic patients. Pain scores were assessed using the visual analog scale, a 0 to 5 system, 0 being no pain and 5 being the worst pain imaginable. Pain scores reduced from 5.43 to 3.97 after listening to music. The second article, titled "Music Therapy Increases Comfort and Reduces Pain in Patients Recovering from Spine Surgery," was conducted by Montanaro and a team of researchers in 2017. This research article is a level 3 experimental design consisting of 60 participants. Division of participants into conditions was done by randomization from a blinded statistician who was unable to access patient information. Both the control and experimental groups were provided standard of care. The experimental group also received a 30-minute musical intervention in an 8-hour time frame within 72 hours post-op. The musical intervention choice was appropriated to the patient's current respiratory rate and clinical presentation of pain. The musical choice was selected to match natural harmonic tension resolution cycles that occur within the music to the patient's current status. VAS results identified an increase in pain levels in the control group from an average of 5.20 to 5.87. The experimental group pain scores decreased from 6.20 to 5.09. Based on these two articles' findings, it implies that musical therapy in postoperative patients may aid in pain reduction, ultimately increasing pain management. Further research is needed to identify long-term outcomes for this type of complementary intervention.
The following study focuses on the effect of massage therapy on postoperative pain management. This study, titled "The Effect of Brief Massage on Pain, Anxiety, and Satisfaction with Pain Management in Postoperative Orthopedic Patients," was a level 2 randomized control trial. The 13 researchers who wrote this article wanted to research if massage therapy is an effective complementary therapy to manage pain, reduce anxiety, and improve overall patient satisfaction in patients who received a lower extremity orthopedic surgery. The 25 postoperative patients in this study group received a 5-minute massage of both arms and hands in addition to analgesic medications. The control group received only analgesic medications to control their postoperative pain. The visual analog scale was used to measure pain, anxiety, and satisfaction in both the control and study groups. Each measurement was taken 5 and 45 minutes after pain management interventions were accomplished. There were no statistical differences in pain or anxiety in either of the control group or the study group. However, there was a significant increase in satisfaction in the study group. Though there was not a decrease in pain or anxiety, the patients felt that their pain management was satisfactory. Finally, reflexology was also researched as a complementary therapy for postoperative pain management. The reflexology study chosen was titled "Analgesic Effects of Reflexology in Patients Undergoing Surgical Procedures," a randomized control trial. This level 2 randomized control trial was written and researched by 9 authors with various medical degrees who wanted to know if foot pressure manipulation aided in pain management when used in conjunction with analgesic medications. A total of 164 postoperative patients were used in this study. The control group consisted of 87 participants, and the study group consisted of 77 participants. The control group only received analgesic interventions for pain. The study group received a short foot massage and a 20-minute reflexology session that focused on manipulating pressure points on the foot that affected the respective surgical sites. The visual analog scale was used to assess pain in both the control and study groups. The study group reported a decrease in pain after reflexology therapy was given in conjunction with analgesics in comparison to analgesics used alone. This was confirmed through statistical differences in the VAS scores when comparing the control group and the study group. While these studies show that complementary therapies may be a great option to use for postoperative pain management in addition to opioid administration, there are several limitations that we found. First, all of the studies that were included in the brief had small sample sizes. Second, only 2 of the studies were randomized control trials. With larger sample sizes and additional randomized control trials, greater arguments could be given for the validity of these complementary therapies and their effects on postoperative pain management. Another limitation to these results is the fact that all of these studies only looked at the effects of the intervention on acute pain in the postoperative period. None of the studies followed the patients long term. Therefore, we cannot deduce that these outcomes promoted faster recovery and provided better overall patient outcomes. Further study is needed to determine the long-term effects of acupuncture, music therapy, massage therapy, and reflexology on postoperative patients. As the research study shows, acupuncture may be provided for acute pain relief in the postoperative setting. More applications of acupuncture might provide even greater relief for patients. However, as stated before, the effects of acupuncture on overall patient recoveries cannot be determined. Musical interventions may provide brief acute pain in the postoperative setting and may be used as an effective therapy for nurses. Massage therapy and reflexology both show a decrease in pain and an increase in satisfaction.
An important role that nurses play is that of a patient advocate and educator. It is our job as future nurses to advocate for our patients' pain management and ensure that they experience optimal relief. We also are tasked with educating our patients on the risks and benefits of opioid use, the other therapies available for them. The research we gathered should be considered a starting point and used as a catalyst for future studies to identify other pain management strategies. Understanding the effectiveness of multimodal pain management approaches with the application of different complementary therapies may help decrease the dependency of opioid administration in the postoperative period and increase overall patient recovery outcomes. However, it is not enough for us to say that further research is needed. We can do more by implementing change in the facilities in which we work, by starting a journal club in our unit, approaching the administrative board, working with physicians and other practitioners, and even involving ourselves in research in this area could lead to major changes. We also make an impact by incorporating complementary therapies into our own practices to help provide optimal pain relief and holistic care. Overall, we have the opportunity to create a change in the healthcare field, and this evidence-based practice brief can be regarded as a stepping stone into a greater world of optimal patient care. Thank you for attending our presentation.